today we speak with professionals in different fields and talk to experts about things that really matter to women in the 21st century. And of course, the gentlemen can join. This is not exclusively for women. So please put it out there to our fellow men who are interested in all these different topics. Today, it's very exciting. It's a topic that has always interested me. I've been in the beauty industry since I was 13 years old as a model, and then Miss Universe. I'm Michelle McLean, your host. I'm a success coach and a former Miss Universe. And today's topic is really quite interesting in terms of the world that I've lived in. It's about plastic and cosmetic surgery. And we have with us today Dr. Gill from Pulsar Health in West Palm Beach here in Florida. She is a double certified board plastic surgeon. And we're going to be chatting about the difference between plastic surgery and cosmetic surgery, the different options available. And so without further ado, Dr. Gill, welcome to Women's Virtual Chats. Thanks for joining us.
Hi, I'm honored to be here. I'm so excited. So I'm looking forward to this. Thank you, Michelle.
Wonderful. Well, I'm going to get into your history very, very soon because you are also a craniofacial surgeon. And I would like to understand, what the difference is between a plastic surgeon and a craniofacial surgeon. But first, could you explain to us, it's always bothered me why we use two terms, plastic surgery and cosmetic surgery.
Plastic surgery is a broad field. It includes reconstruction, like if you have a breast cancer and you need a breast reconstruction, that's part of plastic surgery, but that's not considered cosmetic because it's part of your body as it was before the cancer happened. Plastic surgery includes hand surgery. If you injure your fingers or have an accident, we also repair that. The first kidney transplant was actually done by a plastic surgeon, Dr. Murray, and he got the Nobel Prize for that because we do microvascular surgery, which means moving something from one part of a body to another. So plastic surgery encompasses a lot of different types of surgery where we repair wounds, we repair tissues, we move things around. Cosmetic surgery is more about refining things to make them as beautiful as possible. And sometimes the two intertwine. I specialized in pediatric craniofacial for a while. I also did some gender affirmation for facial. And in that, you're trying to do the best of reconstruction and aesthetic together because each teaches you a little something, like what do the tissues need, what is the best look, because you don't want something to look fake, you want it to look natural, like that's what they were meant to be. So that's the goal. Now where cosmetic and plastic differ is the route to get there. People who have cosmetic surgery as their title, they could have been a family practice doctor, could have been a dermatologist, could be an ENT surgeon, could have been at different routes to get there. They haven't done plastics residency. So I did general surgery, completed a general surgery residency, and then completed a plastic surgery residency for 3 years. And so people can do a cosmetic surgery fellowship and have a 1 year of experience and be considered a cosmetic surgeon. So it's the background is how many years of training, what type of quality of training they've had. And some people can also do shorter courses too and have that title. But many plastic surgeons also just do cosmetic or aesthetic surgery. So just because they have that title doesn't mean that they haven't done all the training. You just have to look a little further.
I believe that you studied in the UK. Why did you study there, and how does the industry or the plastic surgery and cosmetic industry differ in Europe from here in America?
I grew up in England, so that's why I studied there. So it was just part of growing up, and I moved to America because of the opportunity and the broader thinking, the more cutting edge things. But I grew up in England, and I love growing up there. It was very wholesome growing up, and I went through the National Health Service. I became a member of the Royal College of Surgeons. The way that people are taught in England is that as a surgeon, you look after all the medical problems as well as the surgical problems. The patient is yours, rather than sending to different specialties if they have an issue. So there's a difference in philosophy body and how we take care of the patients. It's less compartmentalized. The reason for coming to the States was I wanted to do research and I wanted to do advanced procedures and care. So that's why I came over. The difference in plastic surgery in England versus in Europe versus the States is different in aspects of beauty. They tend to use smaller breast implants in Europe than they do in the States. When we do fat harvest, which means we take fat from a part of the body and put it somewhere else, we tend to take it from the thighs in Europe, and in the States we tend to take it from the belly. So there's little differences in what's considered beautiful and in the kinds of procedures we do, or the extent that we do the procedures to, if that makes sense.
No, that absolutely makes sense. We'd like to invite our viewers to join in and send through questions. Maybe you could answer a few of those questions if we have time. So I'd love to have our viewers participate in this conversation. And actually one of the questions coming from Anna, and in London, so we have viewers around the world.
Hi, Anna.
Is asking us, so the social differences, the approach that women have to plastic surgery in general, European women as opposed to American women. There's a perception that American women go over the top. Everything's bigger and better in America. So you were mentioning the breast implants are bigger. Do you see a difference in culture, appreciating cosmetic surgery?
I do see a difference. In America, we're very, very image conscious, and everything is Facebook, Instagram, and what I liked about America though is when I came here, everyone was dressed so nicely, and they have massive wardrobes compared to Europeans, and they love to look good. You know, it's part of the American culture to put on some makeup and to look good. And in Europe, it's not as emphasized, you know, so it's different. And even in the States, there are cultural differences in like hair, in like how big you want your breasts, whether you want them to look natural or fake. You know, like in Florida, people prefer to have more of an upper pole kind of look. In California, they prefer like a more of a natural, you can't quite tell kind of look. But again, that also depends on your age group and what your style is. So there are cultural differences, but it's important to have the patient know what they're going to get and be happy with the result, because ultimately it's their body, they will need to live with it, and you want them to be happy. It's a dream come true for them.
Let's talk to that point. Now, a doctor does want their patient or client to be happy, but there is something called dysmorphic disorder, and it's becoming more and more rife in society today with social media and influencers and media in general representing that women need to look younger. There's so much pressure on that. Do you find a lot of this disorder in our society?
I have surprisingly no. I don't know whether I just attract people who don't have it or what, but usually when people come to me, I see what bothers them. And I thought initially when I was a resident that I would see more of that, but I didn't. They came in with a problem. I know how to fix it, and we got on and fixed it. Like, I've not really had anyone who's come in and said like, I've had people who have wanted surgery that I think it's too early for surgery, or they should have something non-invasive. I've had people who I think surgery is not the right option for them. But I can see what bothers them. You know what I'm saying? Yes. I haven't yet attracted a clientele that is like bothered by something I can't see. And if it was, I would say no, because it's not appropriate. You know, you want to do the right thing by people.
So dysmorphic disorder is someone who, maybe you can explain that.
They misperceive something as being abnormal or as being ugly or wrong with them, when in actual fact there's nothing abnormal going on or nothing pathological. So it's a misperception in their minds of what's wrong, and sometimes people want to have more and more procedures, and you're right, many people have way too much done by I don't know who, but somebody didn't say no and they should have said no. It's much harder to fix a problem when somebody's had too much done than if they've not had much done. So I definitely am a proponent of less is more, but prevention is also really good too. There's a lot you can do to not necessarily look younger, but look your best at any age. And that requires active work. It's like brushing your teeth. If you don't brush your teeth are going to fall out early, you know? And so it's same with beauty. If you don't take care of it, it's going to disintegrate faster than it should. So there's a lot to be said for prevention, but not going overboard.
That's a very, very good point, Dr. Gill. We have a question from Petra in Los Angeles, and this is, what is the difference between invasive and then your plastic and cosmetic surgery?
Hi, Petra. Thanks for asking. Usually by invasive, we mean that you have an operation where you go to sleep, that you have to have some kind of anesthetic, whether it is conscious sedation or a formal anesthetic with a tube that helps with your breathing. Non-invasive implies that it can be done with numbing medicine, whether the numbing medicine is injected or just put on the skin. Either way, you're awake throughout it. So that's the difference. Non-invasive can be something as little as having a peel, or it can be something as big as having threads, which dramatically change your look. So non-invasive covers a big spectrum, but it's basically whether you're conscious and awake or you're semi-conscious or unconscious.
I mentioned earlier that I've been in the modeling and beauty industry for many, many years of my life, and I have seen some very interesting results to plastic surgery, to say the least. And it's made me very nervous. One of my mottos has always been, I want to grow old gracefully. And I don't want to have to do things or do things unnecessarily and at the wrong age. You were mentioning something earlier about the appropriate age for a woman to start plastic or cosmetic surgery. What would you suggest in terms of that?
Okay, so when you're a baby, you need to start sunblock. So that's really important. And it does prevent skin cancer, it prevents wrinkles, it prevents discoloration. So sunblock, 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 very important. When you are older, also you want to treat acne before you get the scars. We do have treatments that can reverse the scars, like the Vivace radiofrequency microneedling, but you don't want to have to go through that. You don't want to have to like have scars and then fix them. If you can be on top of acne as a kid, as a teenager, it's much better than having it get that bad. And it also ruins your social life as a teenager, which is huge. And then as you get older, the next stage of intervention is having Botox or Dysport, which relax the muscles. And I don't start them immediately. I start them when you have a line that doesn't go away at rest. So that's my, it's not like, oh, you're 25, let's start it. It's like when your particular skin is starting to form permanent lines that are not going away, that's when I start it, because then it can prevent you from getting those lines. And that makes you look less angry, it's more relaxed, and it just, you don't have to go through that whole wrinkle thing. So again, prevention is important. After that, filler is helpful for a lot of people. Filler has got a big, it's got positive and negatives from the overdone lips, for example, although it has helped a lot of girls feel more confident with some fuller lips. The other thing with filler is what happens as you age. Do you want me to explain this real quick to you?
Yes, that would be wonderful. Thank you.
What happens when you age is you have 4 layers I want you to think of in the face. One is your skin and on the surface, and the deepest layer is your bone. And in the middle, you have your muscle and fat. Now, there's 2 kind of layers to the muscle and fat. There's a deep layer and a surface layer. The deep layer starts to shrink and the surface layer starts to fall. And so you have different things going on. So just lifting stuff won't necessarily look good if you don't address the skin and the wrinkles. But sometimes you have to lift stuff, and then even if you lift stuff, if this is like shrunken, it's not going to look right. You have to fill this stuff too. So as we start our discussion with time, we have sometimes we need a little bit of filler to help. For example, me personally, last year I had various things done to see. First of all, I was testing everything because I like to test as much as possible before I do it to other people. Not operations, but non-invasive stuff. And I had threads put in, I had filler put in, I had lasers, I had Vivace, I had a whole bunch of stuff on my face. And it's worn off to some extent, but there's still some residual benefit. Like these are not as deep as they were. So it's useful because I've had a whole year of looking younger than I did last year, you know, and why not?
Absolutely.
My skin is better quality than it was 3 or 4 years ago because I had the Vivace, which has reduced my acne scars. And so you can have anything done at any time, but if you want to look younger, you want to see, well, which area is the problem? I have one of my favorite patients came in one time and she wanted threads done because her dermatologist was going to do it, but I'm a craniofacial surgeon, so it made sense to get an opinion at least. And she said she looked too old on her passport photo, like she looked way older than she felt. And I looked at her and she did have some sagging. She also wanted her eyelids done, but she had the texture of her skin was what was making her look old. Her pores were big, her nose was red, she had like some broken capillaries. And so even if I'd done the threads, she would have looked like a tight older person, if you know what I'm saying.
Yeah.
What she needed was her skin quality to improve first. And so I had her on a skincare regimen. I use ZO quite often to correct things. It's a medical grade line of skincare. And then I had her do Vivace, and Vivace is radiofrequency microneedling, where it improves the surface of your skin, and that's why I was saying it gets rid of scars to some extent, and it tightens. So we've done 3 or 4 of those, and her skin is looking way better. And now she still has some redness and broken capillaries and pigment spots, and we're using pulse dye light to help relieve that. So she looks smoother, and you don't know why they look better, but they look better. And we may or may not even do threads because she's tightened up with what we've done so far. So you want to not just treat people with what they think they need, but as a provider, I want to give them the thing that they want, which they want beauty. So like, okay, which thing is stopping them from looking beautiful, and what do I need to address first?
That's a very important point, Dr. Gill, is that many women, they do seek advice, but sometimes we don't know who best to go to, because it seems like everybody and their dog right now is doing procedures. So, you know, it's given cosmetic surgery and non-invasive surgeries or procedures a bad rap. How would we go about, you know, for our viewers, for anybody out there, advising people who to go to get the right advice?
It's very hard because a lot of times you're offered what they have, you know, and it's hard to know who to trust. People may be good at one thing and not good at another, and there's no right answer to that. You know, it's like it's to find a great plumber can be hard. To find a great construction worker can be hard. It's hard to know who the right person is. As far as plastic surgery goes, I always recommend finding a board certified plastic surgeon, and not any board, but somebody who's part of the American Society of Plastic Surgery or American Society of Aesthetic Surgery. Those people have had further testing, and their results have been looked at after they graduated, and they've vetted a certain standard. So for plastic surgery, that's what I recommend. But any individual provider can be a great provider, you know, so it's hard. I'm not dishing anybody, but I'm saying that if you don't know, like going for somebody with the ASPS logo or the Aesthetic Society logo is something to look for. As far as other injectors go, I wouldn't necessarily go for the cheapest person. I would go for somewhere where you get value for money, but it's your face. You don't want to just put the cheapest stuff in it or on it, you know, or even on other parts of your body. But you don't want to pay exorbitant amounts either. So you've got to try to see what's value for money, have a conversation with them, see if what they're saying makes sense. If you can see any prior results, that's helpful too. But some of it's gut instinct. Like, can you trust them? You know, are they listening? Are they good? So it's hard to say. I can always offer you a second opinion. You can always, like, if you're part of the Women's Expo, you can. We have a special code at the end, and I can give you a consult either online or in person because you're part of this. So I'm happy to do that anywhere in the world, and and because I think it's important to have more than one opinion, and to see like is what they're saying reasonable. And I do that with my friends too if they have a medical problem, because I did general surgery and I've got a lot of experience in like medical care. Like I like, if you have a problem, run it by me, you know, because let me see, is what they're doing sensible? Like is that right, you know? So always feel free to reach out to me for a second opinion if you want.
Well, that's very, very generous of you. Thank you. And I'm sure our Floridian women will be running to you, flocking to you for advice. I certainly will, that's for sure. Let's talk about Pulsar Health and your practice and what different procedures you offer there.
So there's 3 different components to Pulsar Health, and my philosophy is beauty built on health. And so I want people to be as healthy as possible. If we can treat your condition in a non-invasive way or without surgery, I prefer that, because anytime you do an operation, there's a risk, you know. So if you can do it without that, it's better. So we have wellness a part, and we have a med spa part, and we have a plastic surgery part. For the wellness part, we do acupuncture, massage, we have a cryo cabin and an IR sauna, we do immune therapies, IV bar. I did a lot of research in immunology. I did 3 years at NIH of cancer immunology research, and I did 2 years of basic science trauma immunology research at Pittsburgh, and I've also got a master's in biotech from Hopkins. So I've done a lot of immunology things, and so I'm very about wellness, how we can optimize our weight, our energy levels, our immunity. So that's one aspect. Then the second aspect is the med spa, which is more the beauty side. And here we have facials, different types of facials, hydrofacials. We have the skin resurfacing with the Vivace. We can even do it with laser. We have laser hair removal, reduction. And then we have the pulse dye for pigment. We'll obviously have fillers. I teach doctors how to do threads. We had a class last Saturday, and I've got one coming up another 3 weeks, where doctors from all over come here and they learn how to put in the threads. And we can talk a little bit about pluses and minuses of threads, because it's very in right now. And then from the plastic surgery side of things, I do the aesthetic, like breast augmentations, tummy tucks, those kind of things, as well as I'm going to be starting to take insurance soon too. So I try to offer everything so that I know it's confusing, but I want to have people have an option to get the right thing for them. You know, that's why I've kind of spread it out so much, but I want them to get what's right for them.
That's really interesting that you focus on quite a few elements and quite a few procedures. What is your favorite procedure, and what is the most popular procedure?
As far as med spa goes? Or
yes.
Okay, med spa, I think the two, I have to say 2 for med spa. They're very different. The Vivace micro needling, the radio frequency micro needling, is so nice. I've had it done twice. I'm waiting to have it done again. It makes the skin look so much better and you only have a few hours of redness. That's it. And it really does resurface, and you shouldn't have it quicker than 4 to 6 weeks apart. 4 weeks is the minimum. But you look so much better, and it's just so gratifying. And then the threads is not everybody's suitable for threads, but if you are suitable for threads, it instantly changes the way you look. You know, it's just that's the beauty of it. And you do get very.
What would make you suitable for threads?
Well, for threads, you want to make sure you don't have too much skin. If you're too loose, then you really need to have the extra skin cut out, because otherwise you just have wrinkles where you pull it tight. So that's it. And you have to see how elastic the skin is too, whether it's going to respond well with the threads. But if you have droopiness of the face, like I had these like deeper folds, and I had these little jowl things that's starting, which I do not like. So that was with threads. Things like tightening this chin area. It depends if you have fat there or whether it's just skin, but that works really well with threads. Doing a little brow lift works really well with threads. Things that are subtle but early stage of not looking like you would want to look or how you used to look. So that's the best candidate. And somebody not too thin or not too fat either, because you have to have the right amount of tissue in between. And sometimes you have to treat the skin to make it a little bit stronger before you can put the threads in.
So what actually happens to the threads, and what is it? I was told it's like nylon.
Yeah, nylon is a permanent stitch, but it is like nylon. It's something that dissolves. The ones that I like to use are PDO threads, and they're polydiaxone. They're very strong. They're very inert. They don't really react with a lot of things, and we use them in plastic surgery as sutures too. And there's two different types. One type are barbed, and the like fish hooks, and the other type are smooth or spirals. So the barbed sutures are the ones that you put in and then you pull and they do the lifting. The smooth ones are the ones that you can put into areas to fill the area, like for the temples or along the lip or along certain necklace lines. You can use the smooth ones to help with those areas. The most dramatic results are obviously with the barbed ones that do the lifting. But you can have problems though. You can have bad results. So I don't know if you want me to talk about that too.
Yes, I certainly would, because I think that's something that women often don't reveal, is how many botch-up jobs there really are. So please talk to that point.
So threads is one of the technically most challenging things that we do. Fillers is somewhat challenging. Botox is like very easy, but threads is something that you need to have some level of skill to get it right. You have to put the threads in not too superficial and not too deep. Like if this is the skin and this is the muscle, if they're too near the skin, you can get dimpling. And if they're near the muscle, you can get what's called animation deformity. So when you move, it kind of causes a weird kind of dimple thing. So getting that dimpling effect and the wrinkling, if you have too much skin, are the most common problems with it. Also, if people are not careful in how they do them, you can end up with bleeding and a lot of swelling. You are expected to swell a lot in the first few days, but that should go down within a week or two. And people who don't take care with, I put in epinephrine and numbing medicine, and they reduce the blood vessels in the area before I put the threads in, so that there is minimal bleeding. Because I don't want people to be losing blood and having collections of blood in their face. And so you wanna make sure that your provider, like I even put threads in with people partially sitting up to see, okay, how do I want them to look with the effective gravity? Like, does your provider just do it lying down, or do they sit you up and check it and look at it? So there's a lot of little things that go into getting the best possible result. And the things that can go wrong are you can look very asymmetric. Everyone's a little bit asymmetric, but you can look weirdly asymmetric. You can have dimples. You can be bruised, and the swelling can last a long time. So there's a lot of things that can go wrong if you don't know how to do it the right way.
Yes, those are many, many things that we have to be sure about and go to the right person, obviously, for that. Let's talk a little bit about laser for hair removal and pigmentation. What works, what doesn't? Is it really that effective? I've in the past spent a lot of money on many different sessions of laser. I've seen some results, but not incredible results. So what works and what doesn't?
So there's three types of lasers that people use generally for hair reduction. They vary on the wavelength of the laser light. So the Alexandrite, which is 725, is the most effective laser, but you can only really use that on people who have fair skin. If you have darker skin, you have to go for the ND-YAG laser, which is the longer wavelength, because otherwise you could cause pigmentation problems with the skin. Now, the Alexandrite is 40 times as effective as the ND-YAG. So if you have darker hair, and laser doesn't work on very fine hair, you have to have thicker hair and dark hair. If you have that kind of hair, then the Alexandrite is amazing. Within like 6 or 7 sessions, it should be like very little hair left, or it should be just the fine hairs left. The ND-YAG you have to use if you have darker skin, so it takes much longer, but you do eventually get there. Also, it depends on what part of the body, like areas that are more hormonally sensitive, like your bikini area, your Brazilian area, they can be harder to treat because your hormones try to keep the hairs going, but they should respond. Sometimes you have to up the laser settings. The third type of laser that people use is called the IPL, which is the pulse dye. It's not really a laser, it's it's more of a pulse dye, and that's what some of the cheaper machines are. I use the pulse dye not for hair reduction, but for pigment and for capillaries. So it has its own uses. I don't use it for hair because it would take forever and not be that good. And so you have to, you should ask your provider, okay, what type of laser do you have? Is it the Alexandrite? Is it the Nd:YAG? Is it the IPL? And don't go to somebody who just has the IPL.
So what then is the difference between the radio frequency microneedling and skin resurfacing and tightening as opposed to the laser?
So the radio frequency microneedling has tiny little needles that go into your face. And the machine that I have is the Vivace, and that's been shown to reduce the acne scars, which have been very difficult to treat in the past. The needles can go in at different depths. If you have just some of the pens that are available that some of the estheticians use for microneedling, they're only allowed a very superficial depth. Like a machine like this can go much deeper. And it also has the radio frequency. The radio frequency tightens the tissues. Now it can't tighten something that's like a complete saggy bag, you know. It has to be within reason. So you have to get an opinion, like, is this too much? Is it worth doing? I saw a lady who came in for a tummy tuck and her skin was quite loose, and the Vivace wouldn't have helped her. It wasn't worth it. For her, it was better just to have the proper surgery and not try to tighten it. But for some people, it may be worth it. So you have to have a judgment call and do the right thing.
Dr. Gill, I'm sorry, I'm going to have to ask you to wrap up a bit, and I want you to mention your code for those who would like a consultation with you, because you've been very generous in sharing your time with us, but unfortunately we have run out of our time together. So for anyone out there who is still interested in getting a consultation, over to you, Dr. Gill. Please share with us your...
Yeah, just call us at 561, it's Florida, and 561-388-9571, and the code is WEE. So WEE, to get your complimentary consultation, whether it's skincare or plastic surgery. You can talk with me. It can be online or it can be in person. So thank you so much for your time, Michelle. You're amazing. Thank you.
Thank you, and I look forward to seeing you. I'm very fortunate. I live here in Florida, so for all you ladies out there, if you want to come and have a holiday, come to Miami and visit, or come to Florida and come and see Dr. Gill. Dr. Gill, thank you for your time today. I'm sure many women are inspired and even more informed now what the different options are out there. So thank you so much for your time, and to all you lovely ladies and gentlemen who've joined us today for our Women's Virtual Chats. We really appreciate your support. Please join us again next Wednesday when we have more interesting experts and